Right, start again. Good morning, everybody. This is the decision session of the Executive Member for Adult Social Care and Health, which is myself, Councillor Carol Runciman. It's Wednesday, the 13th of July, 2022 at 10 o'clock. And we are going to look at issues around public health in particular. I have no declarations of interest to make, other than those that are already recorded. I've read the minutes of the previous meetings and I'm happy to sign them as correct. Thank you, Jane. We have nobody registered to speak from the public, but we need to make sure that people know that this meeting is being recorded for webcasting. So we'll now go into agenda item 4, which is the allocation of the underspend from the public health grant, which of course is a ring-fence grant, isn't it, Kira? Yes.
Oh, thank you. So, yes, so this paper outlines our proposals to allocate funding from the Ring Fence Public Health Grant, which is around some underspend that we have, and sets out basically the reason for that underspend was due to some staff vacancies and also some business as usual activities that were unable to happen during the COVID pandemic. So we've outlined a number of areas that we would like to give that investment to, and we're seeking your approval for that at this meeting. So I'll just run through the areas that we're wishing to allocate funds to. So the first one is around the Changing Habits programme. So this is a service that is based within GP practices and some other venues across the city. And it is basically to give some support to people who are drinking to hazardous or harmful levels, and that is causing some issues within their life. So by giving some additional funding to this work, we'll be able to continue that service until June 2024. It will mean that during that time we can continue to evaluate the effectiveness of that service, and at June 2024 that's when our substance misuse contract is up for renewal. So at that point it either becomes a substantive part of that service or we decide it didn't work, but it just gives us additional time to consider that. The next area that we want to give some funding to is around addressing the needs of children and young people. So as you'll know, we undertook a survey of school children across York last year, and we've been analysing the results of that. And there are some key areas that have come out of that survey that we would like to have some investment to actually start to address those. And there's kind of 4 key areas that have come out from the survey, and also in conversation with schools have told us that they would like some additional support. And that is around diet and nutrition, particularly energy drinks has come up as a real concern for schools. One is sleep. The other one is children who've expressed that they don't have anybody to talk to about the things that are concerning them. And then the 4th one is about healthy relationships and some of the things that children expressed as they felt was quite normal within a relationship, but raised some concerns for us. The next area is around suicide prevention training. You'll be aware it's something that we funded in the past, but we don't have an ongoing budget to continue supporting that. So we would like to be able to offer that still to frontline workers in the city. And there's 3 courses. There's the assist training, also the safe talk training, and then some bespoke training that Mind offers. So by allocating some budget, it will enable us to continue that over the next 3 years. The next area is around oral health. You'll be very aware that access to dentistry has been an issue across the city. So we would like to fund some work working with the Community Dental Service to roll out some toothbrushing programs across the city, particularly with some of our targeted communities. So, for example, Gypsy and Roma and traveller communities working with food banks, etc. And then we'd also like to do a bit of a universal campaign, really, for everybody across the city to really promote the importance of looking after your teeth. And if people are struggling to access dentists, that just becomes more important, really, that we have to encourage everyone to do as much as they can themselves. And the next area is around maternal health. So obviously that period when a mother has had a baby can be quite a challenging time and a time of change in the family. So what we're looking to do is to do some further work around what is the pathway when a lady has had a child and is potentially experiencing postnatal depression. So we're looking at how we can support some work through some of our voluntary agencies to be able to work with mothers at that point in time. And that really, the mother's mental health is obviously really important in terms of a good first 1,001 days for the child. The next area is around early communication skills. So you'll be aware of the Early Talk for York programme that is already being funded and ongoing within the City of York. In conversation with the team leading on that work, their focus has been around supporting professionals with early communication skills and the toolkit that they've developed to enable that work to happen. One of the gaps that they had identified was actually how that toolkit can be used by parents and how you can support parents in the home to have some of the skills around early communication. So some additional funding into that would enable them to expand that work with parents this year. The next areas of work around physical activity. So we've recently launched our 10-year physical activity strategy for the city. So a small amount of funding to enable us to kickstart the implementation of that strategy this year. And then tobacco control. So we have our tobacco control strategy and we have our ambition to reduce our smoking rates in York to below 5% by 2025. So there's some actions within our tobacco control plan that we would like to put additional resources to. So firstly, around training and support to our team within the council in terms of particularly how they support more vulnerable clients to stop smoking. So particularly, for example, the homeless community. We would also then like to extend a post that we are currently funding at York Hospital and which will enable that post to continue until that implementation of that work at the hospital. And then we fairly recently undertook a survey around the use of illicit tobacco within the city. So some additional funding would really be enable us to implement some of the findings of that survey and tackle the issue of illicit tobacco. And, you know, more important than ever now, really, I think with cost of living where people look for cheaper alternatives for cigarettes, but often, you know, they can be not particularly good alternatives and have additional health risks to, you know, even over and above smoking itself. And then the next area is around our joint strategic needs assessment. So just a small amount of funding to make our website a bit more accessible so that we can make sure that we have good use of that assessment across the city. And then the final area is in terms of our infection prevention and control. So we currently, jointly with North Yorkshire, fund the infection prevention control service from Harrogate District. But there are some gaps within that service. It traditionally just really provides support to care homes, but I think something that we particularly learned through the pandemic is the range of other sectors that might benefit from some support, schools being an obvious one that came out of that. And then also we've known in the past that, for example, if you have a resident who's requiring directly observed therapy for tuberculosis, that it's a stretch for that team to do that supervision around that therapy. So some additional funding will enable us to make that service a bit more sustainable, and then we'll be looking at the re-procurement in due course of that service. So there's quite a number of areas, and then in paragraph 15 at the bottom there's a table that just outlines the amounts that we want to contribute to each of those. So our recommendation is that we would like you to approve those areas of funding. Thank you.
Thank you, Fiona. And I was pleased to see the Equalities Impact Assessment completed. That was very helpful. For people watching, you'll have to excuse the lights keeps going off, but we keep sitting very still. And I think we'll remain that way until the meeting is finished. Just a couple of questions to you. Maternal health. I think the issue of postnatal depression in the pandemic is one that's coming to the fore. Do you think that that's the case?
Yeah, certainly anecdotally through our Healthy Child service with our health visitors, they have picked up that that there have been more instances of where parents have just felt isolated because there haven't been the usual baby groups and things that were running through the pandemic. So it was highlighted through that service that it is something that we really need to be addressing.
Yes, I think that's absolutely right. Early communication skills, I've been pleased to go to a session or two about that, and it's very, very interesting. But I think what's important is to help parents to encourage their children to speak from a very early age, even really before the child can speak. Is that how you see the matter?
Yes, absolutely. And there's quite a lot of evidence that links a child's vocabulary at the age of 3 and 4 to what their future achievement at GCSE level and beyond. So actually, the more that we can do around that early language development, it just means that a child does copes much better when they're in that school environment and then has better outcomes.
Yes, and of course that's also tied into mental health, isn't it? If a child has got the words to express their emotions and to express how they feel, then they're more likely to be able to get the help that they need because people know there's a problem.
Yeah, absolutely. It just, that kind of, as you say, that communication and ability just impacts on all aspects of a child's life, really.
And then finally, tobacco control. I know that the incidence of smoking in pregnancy is dropping. Is that still the case, or has the pandemic changed it at all?
I don't know if you want to answer that one, Peter.
Yeah, happy to. So it's a good direction of travel for that in York. Actually, we had what you might have called quite a stubbornly high rate of people smoking in pregnancy through the sort of last decade, around 10% over a good number of years, and it just didn't go down. And we have now started to drop more towards the 8% of mothers in pregnancy sort of level, and that has been sustained during the pandemic. We get regular data from the Hospital Trust in York on people smoking at the time of delivery, and it has dropped a little bit over the last 2 to 3 years now, quite consistently. So we seem to be heading in the right direction, and the hospital as of October this year, we'll have more resource through the NHS long-term plan that Fiona mentioned to do some of the treatment and help and support within their midwifery teams. So we hope it can only keep on going in the right direction.
And the funding that will go in from the public health grant will greatly assist that, won't it? Yes, I'm happy to accept the report and the recommendations, and I shall be pleased to see the results of that investment as the public health, the work of public health continues. Thank you very much, Fiona. The second item is item 5, substance misuse treatment and recovery grant. Peter, would you like to talk to that?
Yes, thank you. So the report gives an overview really of how the council and our partners are responding to a new national strategy and some resource that is coming as a part of that strategy. It was published in December this last year. It's called From Harm to Hope, and it's a national drugs strategy covering the next 10 years. Within the strategy has some additional resource and investment to go into treatment and recovery services through a grant which is called the Supplemental Substance Misuse Treatment and Recovery Grant. And so this paper outlines a little bit of the plan for the allocation of that resource and ask for approval for the allocation of that resource in the way that we set out in the paper. So I'll just briefly mention what the grant is meant to be covering. It's a 10-year strategy, but the government have been allocating the first 3 years worth of money to start with. And for us in York, that is around about the 350,000 mark for the first 2 years. And then we're in a category of local authority that goes up to around 450 in the third year. And the plan is asking local authorities and partners together to form a strong local drugs partnership, which will have some formal accountability to central government about what it is in charge of, and really oversees the 3 strands of the strategy, one of which is treatment and recovery services for those with drug and alcohol issues. But the other 2 are probably more towards the criminal justice end of drugs, around the supply of drugs into local areas, and then the demand for illegal substances. The money that is coming to local authorities as part of this into the treatment and prevention bit of those 3 has a number of things it's trying to achieve. It's trying to achieve an increase in the number of people who are accessing residential rehabilitation. So the clients and the service users that we have that are given residential accommodation in order to either detox from the use of their substance or to move to a longer term abstinence through the rehabilitation services. It has a national target to increase the number of people who are having treatment for drug and alcohol issues by 20%. And we've had to agree a local trajectory for York. In very broad terms, these are not absolute numbers, but they're sort of representative numbers. It sort of means that every year we see around 1,000 people in our drug and alcohol services for either drug or alcohol issues, and that will be increasing to around 1,200. So that's the sort of scale we're talking about. And there is also an expectation that the grant will be invested in improving quality of those services, particularly over a number of years. The number of clients, service users that each drug and alcohol worker has had on their caseload has gone up, and we know actually that probably does, in order to increase quality, need to reduce and more manageable numbers given to caseloads. So paragraph 6 sets out the 3-year plan for York under some key headings of what we want to do with this resource. So I've mentioned a little bit about this. We want to increase treatment and harm reduction capacity. increasing our inpatient detoxification and residential rehabilitation placements that we're able to fund. Part of that is particularly in year 1 and 2, when the amount of money that will be given is the lower amount of sort of preparation years, as it were. We're going to be doing a needs assessment, understanding more about our pathways, and building the evidence base for what we'll be investing the full amount of money in year 3 and beyond. I've talked a bit about enhancing treatment quality, but we will be looking a lot around the amount of the number of client service users on caseloads, reviewing some of the training that we're providing within the system, and that feeds into the third point around expanding and developing the workforce. And we know for drug and alcohol workers, either case workers or those who work on the clinical side from a nursing or general practice perspective, we know that nationally there have been shortages in that workforce, and we've got to work locally, but probably also regionally and nationally on new training routes in encouraging people to choose either clinical or non-clinical roles within drug and alcohol services. And that isn't something we can just solve locally. So we are working closely with particularly our regional health training colleagues. The next priority is reducing drug-related death and improving access to mental and physical health care. In January, the Health and Wellbeing Board in York signed the Dual Diagnosis Pledge, which aims to try and get local organisations working in mental health and addiction services to work close together and to integrate the work that they're doing, because we know that when people have both mental health problem and an addiction, it does lead to sometimes those services not always meeting those clients' needs, and we want to improve the quality of what's available. We'll also be looking at drug-related deaths, looking at the numbers and some of the causes, the reasons, and the factors surrounding deaths from both drugs and alcohol, in fact, and as part of this strategy, one of the things we will be closely monitored on actually is drug-related death, and quite large aspirations from the government to reduce. We'll also be looking to alcohol care team models for our local hospital, and what the provision is for those at the hospital who have alcohol issues, and how we get them the support that they need. And then the last bit is about a recovery-oriented system of care. Over the last decade, a lot of the focus has shifted from just purely treating those with substance misuse issues to asking what would recovery look like. And I think in York, actually, a lot to celebrate around recovery communities within York. So groups of people who have formerly been in treatment services who are not anymore being supported necessarily by our treatment services, have themselves formed networks and brilliant recovery groups which enable people to have that group of people around them who are abstinent, who are their social network, and we know that is more likely to lead to long-term abstinence. So that's another item that we're going to be investing in resourcing. And then finally, point 7 just sets out the fact that the government are asking us to form a formal partnership, which we would like your approval of, Chair, today. The partnership the working title is the York Drug and Alcohol Partnership. I think that'll probably be where we end up calling it, though we are still sort of consulting with some of the partners on aspects of what it will look like as a partnership. But we will have a partnership chaired by the Director of Public Health, with the Director of Public Health as the senior responsible officer who's accountable to government for what that partnership oversees. And it is intended it will oversee all of the 10-year strategy locally and how it's delivered. We have a number of outcomes that will be measured on too. The diagram, point 7, also recognises the fact that we work both locally in York, but also do work closely with our North Yorkshire colleagues, particularly as a number of the partners within the drugs and alcohol world particularly some of the criminal justice elements of the strategy, are regional within North Yorkshire and York, particularly our police force covering that footprint, but also our probation services do have a presence in both areas, but also work more regionally. And also actually thinking about the DWP in terms of some of the employment aspects of drug and alcohol services in the strategy, and obviously the Office for Police and Crime Commissioner. So we plan to meet as an alliance across North Yorkshire and York and have a number of work streams which we think we work better on together. Dual diagnosis would be a good example, workforce, drug-related death again, but then there will be many things we will work on at a York basis that our DPH will chair that group locally, and that will be the formal group accountable to government. So the recommendations are to approve both what we're planning to spend the grant on locally, but also to approve the broad outline partnership agreements and partnership arrangements that we that are itemised at point 7. Thanks.
Thank you, Peter. Just a couple of questions. This is a supplemental grant, so we're still getting a grant from the government which is being spent in the normal way. This is adding to it. Yes? That's
absolutely right. So drug and alcohol services, aspects of them are mandated within the public health grant. So we pay for the core funding for York Drug and Alcohol Service from that grant that comes into the authority to pay for all public health services. So I think the supplemental bit of this is meant to indicate that it's on top of what we're already paying through the public health grant.
And the second question, you said in 3.1 that the plans have been written in partnership with several key organisations. What sort of organisations are those?
Yes, so we've had workshops with a number of colleagues. So I've mentioned a few, but at the partnership workshops where we've worked up these plans, we've had North Yorkshire Police present. The Office for Police and Crime Commissioner has sent representatives. Obviously, our provider has been really closely involved in that. So Changing Lives, the York Drug and Alcohol Service, have always been present within that as helping us to form a view on the sort of things we want to be focusing on. Other voluntary sector organisations, so one of the organisations is being funded through this is York Mind, around some of the dual diagnosis work. We have someone with lived experience who works closely with us on some of these pieces of work and comes to our workforce group. And as part of forming the York partnership, we're going to need to expand in terms of the membership, the types of people we're inviting to help us on this work, particularly thinking about the overlap with domestic abuse and with safeguarding services, employment, because one of the aspects of the long-term strategy is a scheme that is called Enhanced Employment Provision, which is working directly with the DWP on getting people with addictions into jobs. So there's quite a wide range, and I haven't mentioned the NHS. Obviously, our clinical commissioning group, as they were from recently, the Integrated Care Board, and then the hospital and the Tees Escombe Weir Mental Health Trust. So quite a large range of people.
And finally, will I receive updates on how that is progressing, particularly towards the government targets?
Absolutely, Councillor Runciman. We have an outcomes framework that the government have given us to measure, for instance, drug-related homicides, number of county lines who have been disbanded, drug-related death. There's quite a set outcomes framework, and we're putting in place the processes to monitor where we are every year and more regularly than that. So we could definitely work on finding the right mechanism to sort of update you and how to update formally through decision-making processes on that. But yeah, I'd anticipate coming back with an update to this paper on a regular basis in the right forum.
Yes, I'd appreciate that. Thank you. I'm happy to accept the report and to agree the use of the grant and the work towards forming a York Combating Drugs partnership. And thank you both of you for bringing these papers today. There's no other business to consider